Hello, my name is Emily Grout. I'm one of a group of specialist nurses who are involved with the lithotripsy service here at the Churchill Hospital in Oxford. Part of our role is to ensure that you are well informed about the benefits and risks of this procedure.
My name is Mandy Spencer and I am the lithotripsy lead radiographer. Either myself, one of the team of radiographers, or one of our urology doctors will administer the lithotripsy treatment. We have produced this short film so that when you come for your treatment, you will know what to expect and hopefully feel more at ease. Lithotripsy, sometimes referred to as extracorporeal shockwave lithotripsy, or ESWL, is the use of high-energy shockwaves to break up kidney and ureteric stones. We use either X-ray or ultrasound to find the stone and focus the treatment. The shockwaves break up the stone, which allows the fragments to pass naturally out of your body in your urine. Each treatment takes about 40 minutes and it will often take a couple of treatments to clear your stones. When you arrive at the Churchill Hospital, go to the reception in the radiology department, which is on the ground floor of the surgery and diagnostics building. The receptionist will check you in and give you a specimen pot to provide a urine sample. You're welcome to bring a friend or family member with you. You should expect to be in our department for around 2 hours. The radiographer will call you to have your X-ray and give you a gown to change into. You will be taken into the X-ray room and asked a few questions to ensure it is safe to proceed. Lithotripsy is not suitable during pregnancy, so for ladies, we also double check that there is no risk of you being pregnant.
Do you remember the first day of last menstruation period?
A week ago.
Okay, good. So I need you to fill this form for me.
You will be asked to lie on your back on the X-ray table. The radiographer will give you some simple breathing instructions while they take the X-ray and then escort you to the Daycase unit. Please bring a dressing gown and slippers to wear in the department. In the Daycase unit, the nurse will record your pulse, temperature and blood pressure and check your urine sample. We will explain the procedure in detail and go through your consent form with you. You will then be given some pain relief medication to help both with the treatment and any discomfort afterwards. Because the treatment is noisy and some find it uncomfortable, we have found that watching a DVD or listening to a CD is a helpful distraction. We have a selection in the department for you to choose from. You are also welcome to bring in your own from home. The nurse will then escort you to the lithotripsy room and introduce you to the radiographer. The radiographer will check your identification and help you onto the table.
Yep, it's Charlotte Grant, 22nd of May.
Once in position, we will explain what to expect during the treatment.
Basically, what's going to happen now is the first 5–10 minutes is all set up. I'm going to move you around a little bit and I'm going to put some warm water underneath you, okay? I'm going to give you some headphones so you can watch the DVD, and then I'm going to do my bit behind the screen. I'm going to come out in about 5–10 minutes and kind of have a chat with you before anything happens, so don't brace yourself, okay? There we go.
During setup, the radiographer will ensure that you're in the best position on the table to allow for accurate stone targeting. Once in this position, we pour warm water beneath you. This is the reason we ask you to bring spare underwear, as those you are wearing for the treatment will get wet. We will then check that there are no air bubbles in the water to ensure the shockwaves can travel into your body efficiently. The X-ray camera will be above you so that we can check that the shockwaves are on target. You will feel a gentle pressure against your back as the shockwave equipment is brought underneath the bed. Once everything is set up, the radiographer will pause the DVD and come and have a chat with you.
So we're all ready to start. The most important thing to do now is to try and stay as still as you can. The shocks are going to come from that pressure you can feel on your back, okay? They're going to start at a low energy and a slow speed, and then my job behind there is to work their energy up to a good speed and good energy to break the stone, okay? It is normal to feel a bit of discomfort from the treatment, but obviously if it gets way too much for you at any point, feel free to wave your hand at me and I can always either stop the treatment or come out and we can turn it down. Okay, do you have any questions before we start?
Is it going to be painful at all?
It basically depends on each person. Some people feel like it's an elastic band pinging against their back, and some people don't mind it and fall asleep on the table. So it does depend on you, okay?
And can I stop at any time?
Of course you can, of course. Just wave your hand at me, shout my name, and I'll come out, okay? So if you want to pop those headphones on.
Sometimes the first shock may make you jump, simply because you're waiting for it and you may be a little apprehensive. If this does happen, don't worry. Just relax and try and get used to them.
Okay, first shock coming now.
At this stage, your DVD will be playing, so hopefully you'll be able to concentrate your mind on that rather than the ticking sound of the lithotripsy machine. During the treatment, the radiographer will remain in the room with you and will be behind the screen adjusting the machine to make sure the treatment is as successful as possible. We encourage you to remain as still as you can, but if at any point you have any questions or concerns, please do ask the radiographer. After your treatment is finished, the radiographer will help you off the table and give you a towel and dry gown to change into. We will then walk you back to the Daycase unit, where the nurse will take over your care. Once back in the Daycase unit, you can change back into your own clothes. The nurse will offer you a cup of tea or coffee and some biscuits while they chat to you about your treatment.
Hi Charlotte, how was the treatment?
Hi. It was okay. I was a bit apprehensive at first, but it definitely didn't hurt as much as I thought it would. And I'm not so nervous about coming back again.
Okay, great. And how was watching a DVD?
We'll also go through what you can expect after the treatment, such as risk of blood in your urine, risk of infection, and how to manage any pain you may experience. We will arrange your follow-up appointment, and when you feel ready, you're free to leave.